Hello everyone, welcome to my channel. Today we're going to be counting down 20 scary facts about bacterial meningitis. Now before we get started with fact number 1, did you know that the word meningitis means inflammation of the meninges? The meninges are the membranes that surround your brain and spinal cord. Now let's start off with fact number 1. Fact number 1, bacteria. Meningitis is caused by bacteria and not a virus or a fungus. There are different types of meningitis, but this type is the most serious. This is because bacteria can lead to death within hours if left untreated. That's why it's so important to learn more about it and how to prevent it. Fact number 2, who can get it? Anyone can get bacterial meningitis regardless of age, race or gender. However, certain people are at higher risk, such as those living in crowded conditions like college students or military personnel. Also, those with a weakened immune system or who have had their spleen removed are at higher risk as well. Fact number 3, how does it spread? This type of meningitis is not very contagious. It doesn't spread through casual contact like a cold or the flu. Instead, it's usually spread through close or prolonged contact with someone who has the infection, such as through coughing or sneezing, or by sharing certain items like cigarettes, hookahs, or eating utensils. Fact number 4, how many cases there are each year? According to the CDC, there are about 3,000 cases of bacterial meningitis in the United States each year. However, most of these cases occur in children under the age of 5. And the good news is that most of these cases are preventable with the use of vaccines. Fact number 5, symptoms of bacterial meningitis. Symptoms of bacterial meningitis include fever, headache, stiff neck, nausea, vomiting and sensitivity to light. In addition, there may be other symptoms depending on what part of the body the bacteria affects. For example, if it affects the covering of the heart, there may be a temporary inflammation of the heart muscle. If it affects the kidneys, there could be blood or protein in the urine. And if it affects the joints, there could be pain and swelling. Fact number 6, signs of bacterial meningitis. In addition to the symptoms, there are also signs that can indicate bacterial meningitis. These include a bulging fontanelle, which is the soft spot on the top of an infant's head. Other signs include a high-pitched cry in infants, drowsiness or difficulty waking up, irregular breathing or lack of appetite. Fact number 7, when to seek medical attention. If you or someone you know has any of the previously mentioned signs or symptoms, it's important to seek medical attention immediately. Early diagnosis and treatment are crucial for preventing complications and improving outcomes. Fact number 8, how it's diagnosed. Doctors use several methods to diagnose bacterial meningitis. They will first ask about your symptoms and perform a physical exam. A lumbar puncture, also known as a spinal tap, is often performed to collect cerebrospinal fluid for testing. This fluid is examined for the presence of bacteria, white blood cells or a reduced amount of sugar. Other tests, such as a blood culture or urine analysis, may also be done. Fact number 9, treatment options. Treatment for bacterial meningitis typically involves intravenous antibiotics to kill the bacteria causing the infection. The specific type of antibiotic used will depend on the bacteria identified through culture and sensitivity testing. In addition to antibiotics, other treatments may include intravenous fluids to prevent dehydration and maintain blood pressure, as well as anti-seizure medications to prevent seizures. Fact number 10, how long it lasts. The duration of bacterial meningitis varies depending on the severity of the illness and the individual's overall health. However, with prompt diagnosis and treatment, most people make a full recovery within 1 to 2 weeks. Fact number 11, possible complications. If left untreated, bacterial meningitis can lead to serious complications such as brain damage, hearing loss, vision loss, seizures, stroke, paralysis, and death. Even with treatment, some people may still experience long-term consequences. Fact number 12, prevention of bacterial meningitis. There are a few ways to prevent bacterial meningitis, such as getting vaccinated against the most common causes of the disease, practicing good hygiene, avoiding close contact with sick individuals, not sharing personal items like cigarettes, hookahs or eating utensils, and avoiding certain behaviours that increase the risk of meningococcal disease, such as using drugs that increase the risk of bacterial meningitis. Fact number 13, the incubation period. The incubation period for bacterial meningitis is the time between exposure to the bacteria and the onset of symptoms. This period varies depending on the type of bacteria, but it's usually between 2 and 10 days. Fact number 14, herd immunity. Herd immunity is a form of indirect protection from infectious diseases that occurs when a significant portion of a population is immune to an infection, thereby providing a measure of protection to those who are not immune. This can occur through vaccination or previous infection. Fact number 15, vaccines available. Several vaccines are available to prevent bacterial meningitis. The meningococcal vaccine is recommended for all adolescents and young adults, while the pneumococcal vaccine is recommended for children and adults at high risk of meningococcal disease. There is also a vaccine available for bacterial meningitis caused by Haemophilus influenzae type B, but this is less common. Fact number 16, vaccine side effects. Vaccines are generally safe and effective. However, like all medical procedures, they carry a small risk of side effects. Common side effects of the meningococcal vaccine include pain, redness and swelling at the injection site, as well as fever, headache and muscle aches. More serious side effects are rare, but may include allergic reactions, nerve damage and inflammation of the brain or spinal cord. Fact number 17, vaccine effectiveness. The meningococcal vaccine is about 85 to 90% effective in preventing meningococcal disease. The pneumococcal vaccine is less effective, but still reduces the risk of meningococcal disease by about 50%. Fact number 18, the history of bacterial meningitis. Bacterial meningitis has been around for centuries. It was first described by the Greek physician Hippocrates in the 5th century BC. In the past, it was very common and deadly, but the development of vaccines has greatly reduced the incidence of the disease. Fact number 19, famous people who have had it. Many famous people throughout history have had bacterial meningitis, including John Stuart Mill, the English philosopher, and politician, Florence Nightingale, the English social reformer and statistician, and Albert Schweitzer, the German theologian and physician. Fact number 20, fun fact. Did you know that there are different types of bacterial meningitis? The most common type is meningococcal meningitis, which is caused by Neisseria meningitidis. Other types of bacterial meningitis include streptococcal meningitis, which is caused by Streptococcus pneumonia, and Haemophilus influenzae type B meningitis, which is caused by Haemophilus influenzae type B. I hope you learned something new today. If you want to see more videos like this, please subscribe. We have lots more coming up. Thanks for watching.